So the 2022 HTSi report, every year put this together, and this is about some of the findings that we as Elanco see and some of the data that we see over the past 12 months. So firstly, for anyone that doesn't know, what is HTSi? It's something that me and the rest of the team at Elanco spend a lot of our time doing, out on farm, essentially collecting data. But we really hope that by collecting data consistently on a monthly basis, it leads to quite a nice data set that you can look at to make informed business decisions where you want to for your companies. It's been going for about 26 years-ish. So you can imagine the breadth and the data we've got in that. It started off looking at just coccidiosis up in Scotland, actually, and then slowly developed to incorporate what we now call the I2 score that Jos has talked about, but also leg health, other welfare parameters. And that came about really because we know that these two birds can have the same amount of coccidiosis but be coping with it in very different ways. So that is HTSi. So intestinal integrity, it's a composite score out of 100, as we've mentioned. And when we looked at over the past 12 months, so all the data in the annual report, as described, was from January 2022 to December 2022. And what we saw birds ranging from 14 to 38 days of age, an average of 24.9. And I think sometimes we get asked, is it better to look at one bird at one age or then look at different ages? But I think with the rate at which we're doing the posting sessions and the rate at which we're collecting that data, it's really nice to get a nice spread of ages so we can start to see where cocci peaks and troughs throughout the bird's life. So in 2022, we looked at over 5,000 birds from 314 farms, from 743 individual houses. And just to give you a bit of a comparison to previous years, I think the highest number I think we've done was roughly 7,000 to 8,000. And currently we've had, as everyone knows, quite a big avian influenza challenge this year. We're also still recovering from the impacts of COVID, hence the number being a little bit lower than previous years. However, we did hopefully manage to continue to collect a lot of meaningful data from this. And from that 5,244 birds, the majority were Ross 308s. We also saw 1.8% of that being cob birds, but also 5.8% Hubbard birds, which is more than we've seen in previous years. And I imagine from the increase of slower growing breeds, this number might start to increase a little bit as well. So with intestinal integrity, see if my pointer works, there we go. So this is the y-axis, so this is 90 to 100 there for those who may not be able to see the small numbers. And then we've got the months across the bottom. In 2021, we saw that this is the green line, sorry. The intestinal integrity of the UK flock did start to decline into the spring, and then it started to improve over the summer here. We had a little bit of variation towards winter, and then this navy line in 2022, we can see again we had this similar decrease that we've seen the past 3 years over spring. However, when we got to the summer of 2022, we saw this continue to decrease further before around September time it's starting to increase a little bit. At the moment, at the end of 2022, we saw that the levels came back to what we saw in 2021. So there's been a little bit of variation over the past 12 months. There's obviously quite a few things that impact intestinal integrity, and the main one, without a doubt, is coccidiosis. But aside from that, some of the things that we found were 31.2% of birds with excessive intestinal mucus, which was an increase of 5% from 2021. We saw a very slight increase from the previous year with cellular sloughing, with 22% of birds affected, and then 21% of birds with watery intestinal contents. However, this was a decrease from the previous year. And other lesions of interest. These are the lesions that kind of had the most movement compared to previous years. As you can see, intestinal hemorrhage increased by 5.4% from 2021. And whole wheat passage decreased, as did litter eating. And then a bit of intestinal hyperemia increased a little bit as well. But the biggest contributor to intestinal integrity score is, without a doubt, coccidiosis. So this graph shows, up on the y-axis here, we've got the severity, the average gross acervulina lesions these are. And then along the bottom, we're looking at data here from 2020 through to the end of 2022. This past 12 months, from January, they have increased to, I think it was 40.15% of birds affected at the peak, which was in June 2022. Of the birds that we saw with coccidiosis, 64% of them were mild, so score 1. And when we're looking at cocci, we're scoring at a 0 to 4 using the Johnson and Reed method, which is probably the most widely used method. So 64% with mild score 1 lesions, 28% were moderate and 7.4% were severe. When we look at the ages at which these birds are affected, so 2022 again being the navy line, you can see here peaking across the industry at about 24, 25 days of age there, which is quite similar to 2020. However, in 2021 we did see this bit of an earlier peak by a couple of days. Comes down nicely to the same rate there. As we've seen some of the birds in the older, post-30s as well, we did start to see a bit of an increase. Unfortunately, we don't have data past 38 days to see whether this continued to increase or has come down a little bit. But also we've had the introduction of slower growing breeds, which I think we're still trying to build that data set to work out where the cocci profiles are in some of the Hubbard's birds. So that might be a contributing factor. This is maxima, so as Jos showed in your previous presentation, this can have a severe impact on the performance of your birds. Interestingly, we've seen, we see maxima throughout the year, but in 2022 we saw this level here that peaked in September 2022, and this was higher levels than we'd really ever seen before in the data we collect. Of the birds over the year, again, the majority were score 1, so we're looking at 85% of these were mild score 1 maxima lesions, and we do look under the microscope and confirm these with microscopy as well. 13% were moderate and 0.6 were scores of 3 and 4, which we class as very severe challenges. And then looking at the ages, again, interestingly, we've got this peak here that is 25 days for those that can't see. A further peak again at 33 days, and then again this sharp increase at 38 days. However, with the majority of the birds we're seeing in this area, I would question, we've had a big peak there. If we were to continue collecting data past that age, what would we see? Would we see it drop or continue to rise? As you'll know, the broiler industry, the days of the broiler's life are getting shorter and shorter, so it might be that we won't know what the peak is past 38. And then finally, this is the gross Tenella severity on your left-hand side, and again from 2020 to 2022. And again, we saw Tenella higher than previously seen. Levels seemed to peak at around November time, but we did see an increase starting in about May up to June, July there. Again, of the birds, we had 93% with score 1, very mild lesions. So I think previous to this year, when we've seen Tenella, it's been your severe score 3 for blood in the cecal content. We wouldn't tend to see much of the milder hemorrhaging and just mild inflammation in the ceca, but that is predominantly what we saw in 2022. And then looking at the ages, in 2020, the red line, and 2021, the green, we've never really seen a peak of Tenella with the data we're collecting. It's probably important to note as well that HTSi is done on your generally healthy birds. We're not looking at your best, we're not looking at your worst. We want to get a really nice, data set of what is your average bird doing in your flock. So as you'd expect, we don't see many birds with tenella, which is a good thing. But as you can see here, as generally as the bird got older, the more we did see. However, we saw birds with tenella as young as 17 days. So what does this mean for producers and for industry? As we've seen, and as you will see in the white paper, that we know that the I2 score does affect performance. So birds that have poor intestinal integrity aren't going to perform to the best of their ability. When we look at an increase in one unit, I suppose, of intestinal integrity, your average daily gain increases by 0.4 grams. Your EPEF increases by 0.52. The FCR can decrease by up to 0.13 points, and your livability increases by 5%. So what we're seeing when we're seeing this increase in cocci and this decrease in I2 score, it can be quite, result in quite costly losses to the industry. So hopefully HTSi can support the broiler industry, and we want to make sure that if, as a whole, we're understanding the challenges that people are under and the challenges that the bird are under, we might be able to intervene. So we want HTSi to be used to make better business decisions, to identify where we are losing these small subclinical diseases, and work with you to try and identify the gaps and ultimately improve the bird and improve profitability as well. And finally, the HTSi process, phase one, when we're talking about the information, that is us out on farm collecting that data. We then saw what do we do with this data? We like to put it into a report, we look at the findings and we benchmark to the rest of UK industry. And then finally, integration, so the recommendations, the interventions, what's the next in this? And predictive modelling predictions, we'd incorporate performance data in all of this as well to really work together to understand how we can improve intestinal integrity.